Merci beaucoup. It's the extent of my French. I'm going to be sharing my screen with all of you. So just give me a second here. Can everybody see this screen? Yes?
Yes.
Perfect. Great. All right. Well, first of all, thank you very much for the invitation. It's a pleasure to be here with you this afternoon. In the spirit of promoting reconciliation and gratitude, I just want to take this opportunity to acknowledge that the work of Alberta Health Services takes place on historical, contemporary Indigenous lands, including the territories of Treaty 6, 7, and 8, and the homeland of the Métis. So what I thought I would do today, and appreciate that Quebec is on their journey about a learning healthcare system. We really do appreciate the opportunity to share with you Alberta Health Services and how we have performed as a learning health system in the province. Wanted to give you a little bit of introduction to Alberta Health Services. We were launched over 10 years ago. It was the amalgamation of 9 regional health authorities and 3 provincial entities, largest amalgamation for healthcare, and we are the largest provincialized healthcare system. We are responsible for running the health system in the province, and you can see here that these are all the different areas that are included, although as we know, when we think about healthcare system, we think primarily of acute care, but you can see here that our spans actually includes multiple areas, including community, home care. We have joint venture agreements with primary care networks. It includes addictions, mental health, seniors, EMS, which is emergency medical services, corrections health, public population health, and Indigenous health. And we are a large organization with over 100,000 staff, physicians, and volunteers. This just gives you a bit of what the landscape looks like. You can see here that Alberta Health, which is the Ministry of Health or government, really is the policy setting arm of healthcare in the province. They are accountable for funding primary care physicians who work in the community. There are 42 primary care networks, which I said we have joint venture agreements with. And the primary care networks themselves have also organized themselves recently to align with Alberta Health Services, which is broken down into 5 zones. We did this very early on after the amalgamation to really allow for more local management and local decision-making, allows for coordination. We work across the zones so that there really, even though it is a zone organized, there really is no boundaries for us when it comes to working together. It really allows us to be able to locally support and engage with physicians and community leaders. And it really allows us to be able to look at things because we know that, metro versus rural obviously are very different. Just moving on to learning health systems, I'm not going to go over the next 3 slides because this is, the context of your symposium. But one of the things that very early on for us, it was really the development of what we call strategic clinical networks. And this is what I would say is the strategic arm of the organization. And it was intention of building these strategic clinical networks, which are grassroots driven. It is based on sort of specialty or systems based. It really allowed us to really build in that learning culture and building in sort of best practices, reviewing best practices, and then actually implementing it locally and then scale and spread throughout the system. We are based on a quadruple aim, just like you are. And this actually just aligns, just shows you how it aligns very nicely with the enhancements in core competencies of a learning health system. And I'll just go a little bit more into that. When we think about AHS and our learning health system, we've really worked hard to really develop what we call sort of a closed loop of continuous improvement. We've spent years building a culture where we are looking at innovation as being sort of the natural part of what we do, looking at the art of the possible, and learning not just from the successes, but also on the failures. As you can see, it really starts with the learning community. And as I said, our strategic clinical networks are really representative of all these different learning committees. They're multi-stakeholder, they're interprofessional, they're grassroots, not top-down, and really the passion that drives everyone together is around how to share solving a problem. We've developed an infrastructure that's actually critical to actually support this. You can't just pull people together if you don't actually have the data infrastructure or the innovation pipeline structure in place to be able to support that. And as I mentioned, it really is around not just the people, but the process and the technology. When we think about Alberta Health Services and how we see ourselves as a learning health system, really having a single health authority that actually is accountable across the province is a very, very helpful process for us because it allows us to share our learnings in a very organic way. Because as I said, when we do scale and spread, the intention is to really ensure that every Albertan, no matter where you live in the province, actually has access to those types of learnings. We have 2 strong universities in the province and research centers that we actually work very closely with. As I mentioned, we are very tightly aligned with primary care networks. And as I've mentioned, we have organized our communities into clinical practice groups called strategic clinical networks. We also have 5 integrated provincial programs like seniors, addictions, mental health, cancer, and so on and so forth. And as I mentioned, in Alberta, probably one of the biggest strengths we have is actually in our data, but you have to have the analytics and the structures in place to be able to support this type of innovation. So we've been building this over a number of years in order for us to be able to leverage off of going forward. One of the things that we've actually done and we're very proud of is our interactions and collaboration with the universities to develop the SPORE unit. And the SPORE unit has actually obviously been there before the pandemic, and this has actually helped us bridge the gap between research evidence and health decisions, and to make sure that health research actually has an impact for patients in the health system. And I understand that one of the big drivers for you in Quebec is also making sure that you have the patients at the forefront and to make sure that the patients are actually helping drive this. And what we've actually developed is something called an implementation science collaboratory, which is really our learning lab for implementation science. And again, very, very proud of some of the work that we've done to actually do scale and spread once pilot initiatives have been found to be successful. This is a fairly complex diagram, but I thought I would use the pandemic as an example of how we've actually used our learning health system to help us deal with COVID-19. And this is, as I said, a complicated structure, but just to say that, the linkages between the federal government, between the government of Alberta and ourselves. And I just want to highlight this here, which is our Alberta Health Services Emergency Coordination Center. This is a center that we actually set up very, very early, actually even before the first case of COVID-19 in the province. And what it really allows us to do is it allows us to not only have a fixed structure in place, but allowed us to have clear linkages throughout the organization to not only mobilize data, but to ensure that the knowledge and the processes that we had to develop to respond to COVID was well implemented throughout the system. And so part of that really used what we had built even prior to COVID, which is the innovation pipeline. And this pipeline was a defined process that was created by the strategic clinical networks and really allowed our clinical excellence teams to bring the evidence into care and then enable very rapid, rigorous, efficient evaluation and implementation. And so you can see the pipeline that is here broken down into 5 steps. But really having this pipeline in place before we even dealt with COVID was very, very critical for us in terms of having to be innovative throughout the pandemic. I'm sure that in Quebec, similarly, you had to be innovative in healthcare for us to be able to deal with all the multiple waves of the pandemic. I just want to highlight something here called the Partnership for Research and Innovation in Health System, or the PREIS grants. And these are grants that we actually developed in partnership with Alberta Innovates, which is an entity in the province which actually funds research and innovation. And this really allowed us to set up seed grants for research projects that came out of Alberta Health Services and the universities. And we've actually moved forward on this for those initiatives that have been very successful. And obviously the value that we actually tested for was really around value on improving outcomes for Albertans. We've actually now moved that into something called the Higgest grants, which actually is now about scale and spread and how do we actually scale and spread these best practices across the province. So another example I just wanted to share with you, and I'm sure this actually also happened in Quebec, is that you can imagine during the pandemic, evidence was changing almost on a daily basis. And we actually needed evidence to actually support some of our guidance and policies and procedures with the never-ending changes with COVID. And so we actually used the leadership that we have with the Strategic Clinical Networks, develop something called the Scientific Advisory Committee. And this group, or the SAG group, really was very, very critical for us to be able to pull in rapid reviews. They had usually sometimes 2 to 3 days. Right now is about 2 to 3 weeks. And to look at reviews, and reviews with things like, visitation restrictions, what should be put in place, PPE guidance, contact tracers, testing centers, how many do we need, triggers that we needed to put in place, whether we escalated up or downwards. And now we're working with nationally funded CIHR COVID N network to really try to reduce the duplication and work across jurisdictions. And we've published several of the reviews. And the latest review, which I'm sure would be of interest.
Et la façon, c'est extrêmement pour vous intéresser, c'est de voir comment bâtir une résilience organisationnelle pour appuyer notre réseau de soins de santé. Voici un exemple du travail incroyable que nous avons fait sur nos...
Imagine, analytics is such a critical aspect of COVID. And our analytics team actually brought together databases in a matter of days to really address the most pressing and complex issues within the healthcare system. So for example, they integrated a very significant provincial data that enabled a very timely provincial reporting and modeling through case surveillance dashboard. We had a hospitalization surveillance dashboard. And here I'm showing you something called the early warning system. And this is a system that we've actually been using throughout all 5 waves of the pandemic. And this has been a very, very good predictor for us for sort of a 2-week out scenario about what hospitalizations can look like. We had this both for inpatients and ICU, and this one is one that's fairly dated. The most recent one actually doesn't look very good right now, but basically what it shows is that you can see here that, back in February of this year, we had about 1,300 inpatients. And then about 2 weeks out from that, it actually predicts us for us to high, medium, and low scenarios. You can see here that the high scenario shows that it would be down to about 745 inpatients. And we've actually found that it's been fairly accurate, and it allowed us to plan for capacity. So we always kept above the high scenario, for an example, for ICU. So we were never in a position where we actually had to transfer any patients out of province. But this is only an example of where we use data and analytics. Another very, very useful area for us was actually in being able to predict out the amount of PPE that we needed. And so we were able to project out probably about 2 to 3 months ahead of time, for example, how many N95 masks we needed, how many surgical masks, how many gowns, face shields, and so on and so forth, and really kept us ahead of being able to make sure that we always have the PPE in place. And in fact, to the point where we actually were able to share some PPE with other provinces, including Quebec. So when we look into the future, I do want to shift a little bit about what does it mean now that hopefully we're coming to at least, being able to live with COVID versus having to deal with, all these acute waves. But really, it is a real new paradigm for us in healthcare. We've been promoting this new paradigm, and I think if anything, COVID has really accentuated this, right? We need to move beyond the illness model. We need to really augment and continue with team-based care. There clearly has to be a patient and family focused, and really, moving beyond out of the hospitals and into the community-based care. And we've done this in multiple ways during COVID. And just to say that, another example for you is that we've actually created virtual hospital hubs. We all know how much virtual care exponentially increased during COVID. And just to give you an example, we always had virtual care before in Alberta Health Services. And in any particular year, we have probably between 50 to 60,000 virtual visits per year. And we calculated that would actually save Albertans about 11 million kilometers of travel. So pretty impressive stats. We know that when we started with the wave 1 of COVID, that within about a few weeks, we actually went up to 60,000 virtual visits in 1 month. So we went from 12 months to 1 month. And we actually, even before COVID, we started this work on a virtual hospital complex care hub We have one virtual hospital in Edmonton, one virtual hospital in Calgary. And you can see here that in the year 2021, we actually increased care to 530 patients. You can imagine that's actually, bricks and mortar for a pretty good sized hospital in Alberta. And we are going to be continuing this work in virtual care. So looking ahead and just trying to conclude and hopefully have more time for questions, it's really what are some of our biggest challenges going forward. And, when I think about challenges, I think more of opportunities. We all have to be optimists when we're in healthcare. But really, when we think about some of our biggest opportunities, is looking at workforce capacity. And I'm sure that's a similar issue for you in Quebec. But I think the opportunity here is really about innovations that we can bring into workforce. And what do I mean by that? Well, no question, when we think about recruitment and retention, there are multiple innovations that we can do. For example, we've actually now partnered with some local colleges to actually have training programs for nurses in our rural communities, because that's where our biggest maldistribution of workforce is right now. We can think about innovations in training. We've actually built in to now our training to actually train for healthcare aides. I'm sorry, I don't know what your equivalent is in Quebec, but healthcare aides. So we're actually training them on site, giving them jobs at the same time to make sure that there is no breathing room for them to actually go out into the workforce outside of AHS. Team-based training, we know that we had to do alternate levels of care when we had the pandemic, in the worst Delta wave. And again, this team-based approach really needs to be optimized. And then education, we know, is key to retention. So there are multiple innovations. How do we ramp up training? ICU training for our nurses, in the past were 6 months. We went down to 3 weeks and 2 weeks practicum. So there are multiple ways that we can be innovative when it comes to that. There are innovations in wellness supports. We brought in on-site psychological counseling for our staff, multiple online peer support group activities. And so again, there are multiple innovations that I think would be opportunities for us to ensure that our workforce is not only retained, but also in terms of bringing in optimal recruitment. We know that surgical backlog and delayed care is a challenge for all of us, but again, for me, this is an opportunity. We actually have been working on something called Alberta Surgical Initiative before the pandemic. And this is really a holistic approach and how do we look at improving surgical access to all Albertans, going anywhere from referral services to wait list management, to centralized booking, to optimizing OR utilization, to post-op rehab care across the province. And so again, we were doing quite well on this, and we did learn what not to do after wave one. And we were very, very sensitive of not cutting back surgeries across the province, as a one-size-fits-all. And so we were actually very adaptive to only delaying care in areas where we needed to. And so we actually were able to manage to catch up on our backlog in the summer of last year. And if it wasn't for Delta and Omicron waves, we actually would be on our catch-up for reducing our wait list further. So no question, Delta put us and set us back, but we are on really ensuring that we have some hard fixes to solving the surgical wait time issue. And then last but not least, I think the onus is for all of us in Canada in healthcare to make sure that we don't go back to status quo. There've been a lot of deaths from COVID, and we can't let those deaths occur in vain. We need to make sure that we continue to get better. As a learning healthcare systems, we have to keep pressing forward. We have to know what's going to be permanent now. There are going to be some permanent changes now that we have to live with COVID, but there are also some things that we need to improve on and to make sure that we, that as I say, don't go back to what it was like before. It is easy to do that, to go back to status quo, but we have to continue to use our data and analytics. We have to continue to have rapid cycles of innovation. We cannot go back to the same kind of timeline that we had before when it came to innovation, because not only do we not have the patience for that, I would say that the public doesn't have the patience for that. And so these rapid cycles of learning, rapid cycles of innovation is something that we have to build into our healthcare systems. So I think there are lots of opportunities going forward for all of us in healthcare. Thank you for your time today, and I'm happy to answer any questions, and I'll stop sharing my screen at this point.
Thank you very much. So we have a couple of questions and we have time for them. So I'll start with a big one. How do you believe we can transform the culture of a health system?
Yeah, you know, everybody talks about the culture piece, and, you know, culture takes time, right? And again, I think over COVID, I think COVID has normalized some things for us that would have taken us years to normalize. And so I think our culture is fundamentally different now than it was before. And I think we need to build on that. You know, if anything, COVID brought us all together as healthcare providers and healthcare systems. You know, we had a common foe that we had to fight against. We had to leverage off and use and collaborate with each other, because you could never attack COVID in silos. And so that collaborative, team-based approach, you know, rapid cycles of innovation, as I said, that's actually now built into our systems. We've had to do this for 2 years. And so what is very, very important for us going forward is not to slip back from that. We need to make sure that we continue to have those supports in place, to make sure that we continue to model as leaders. We need to model and to be very, very clear about what our expectations are going forward, because it is going to be the betterment for healthcare. I fundamentally believe, but you got to support the teams to do that. Talk is cheap at the end of the day. And so we need to make sure that whatever we've built in to deal with COVID, we need to choose to and be very purposeful about what we keep in the system to keep supporting our teams. If we go back and say, okay, well, this is only a COVID support and we don't need this anymore, and it was a fundamental structural support to the teams to work, you're not going to shift your culture, and you're not going to be able to shift that mindset. So really, really important for all of us to go back and really look at what was useful in COVID, make sure we keep those things in place going forward. And I'll give you an example. We just had a recent conversation about our scientific advisory group. As I mentioned, that was a group that we set up very specific for COVID, but it would be a real shame to not have that group in place still. Now, it may be different in how it functions. It may be different in terms of the questions that we put forward, but, you know, this is a group that we're intending to keep on, but we're going to adapt to what it means now to be living with COVID versus having COVID be at the forefront of everything that we do. So that's what I mean about being fairly purposeful about the things that we built to address COVID. Decide what you need to keep, what you don't want to keep, and then adapt it to our lives going forward, which will be very different.
Thank you. People are sending cheers to you in the questions, saying that your presentation was very insightful, very interesting. I've got another question here. Which institution or which principal actor did you find was the most important ally to bring about this change in new infrastructure?
Well, you know, Alberta, we've had a number of disasters that we've had to deal with repeatedly over the past 12 years. So COVID, in fact, was our 5th natural disaster that we had. The most recent one prior to that was the Fort McMurray wildfire. I don't know if people in Quebec remember, that was in 2016. It was the largest evacuation, actually, of any city or town in the country, of over 80,000 people. And we actually had to evacuate a hospital. We evacuated our hospital, about 100 people, 100 patients within 2 hours of the wildfire. It was kind of crazy. That was our 4th natural disaster. And so what has happened with each time, and I think that's what's really critical for a learning health system. We started back in 2009 with H1N1. We then had Slave Lake wildfire in 2011. We had the Southern Alberta floods in 2013. We had the wildfire in 2016. And I actually said, you know, we're due for a disaster. I didn't really want a pandemic, but, you know, it was almost every 2 to 3 years in Alberta, we would actually get these natural disasters. And so with every one, we actually had multiple major learnings, hundreds of them that we would compile together to make sure that our next, you know, we had to respond again, that we would be in a much more better place. And so I would say that we have spent years building the resiliency of our organization to help us deal with the disaster. So as I mentioned before, our Emergency Coordination Center was set up in January of 2020. we had our first case of COVID in March of 2020. And so we already had set it up. It was public health driven, because at that time it was all public health. And so I would say it was really making sure that you've got the type of emergency disaster management, business continuity practices in your organizations to actually help you deal with this. And what was different about the pandemic for us was that we knew very shortly after that, about a few weeks after we set up our ECC, that we actually had to change the way we dealt with it, because COVID was all encompassing. It wasn't just a fire in a certain part of the province. It was the business that we had to do for every part of the organization. So we changed some of our structures and our connections to tighten it up to myself and my executive team in order for us to be able to make sure that every aspect of the organization was connected. So I would say it was really based on an emergency disaster management piece and how we actually continued to build that over the past 12 years.
Good, thank you. You've talked about your team a couple of times. We have a question about your strategies to address HR challenges that are everywhere in Quebec, also everywhere throughout Canada. So what are your strategies to address these issues about HR?
Yeah. So, I mean, it's not been easy, and I can say that we all have the same challenges. We've been very, very purposeful about developing what we call an integrated workforce strategy. So this is really around the recruitment and retention piece, but very, very closely linked to that is obviously the wellness strategy for our teams. And again, offering multiple avenues to support our teams real time, as well as ensuring that, we've got, asynchronous supports for our teams. Communication has been very, very critical to this too. I think, sometimes not knowing is actually worse than knowing. And so we've been very, very, again, active on communications. And I think that when we're very transparent with our people around, what's anticipated, what's going to be coming up, what are these policies, where are some of the changes? We went from almost daily, actually, updates on COVID to now weekly, but we're still at weekly, where we actually provide updates to our staff. And I just don't think we can underestimate the importance of communications, and then making sure that with every opportunity, we always remind our people in our organization about where they can go for help. We have a 24/7 access hotline for people that can get real-time supports at any time of the day, including for their families, because you can imagine it's, not just, the worker, it's the worker's family who may also be stressed. And so it really is around in supporting them and themselves and their circle of loved ones. And like I said, taking every opportunity to remind them where they can go for help and how to access it, and the fact that they're not alone. And that's a really important message that we can all give, as well as, strategies and programs that we've developed. Happy to share those if you're interested.
Good, thank you. We have time for at least one last questions. I have received one that is quite original, and I'm going to ask it to you. First, the person says, thank you very much for your presentation. And then, what mechanisms are in place to integrate Indigenous knowledges in healthcare innovations? What would be your vision?
Indigenous, is that right?
Yeah, Indigenous knowledge, traditional Indigenous knowledge. Yeah.
Yeah, so I'm really proud that we have something called the Wisdom Council that drives us to provide input and guidance to us as settlers in Alberta to help support the Indigenous communities. We actually have what we call health advisory councils, as well as provincial advisory councils. These are community public members that actually help us provide us input into the local communities, as well as giving us guidance on where we go in terms of our policies and direction. And one of these groups is, as I said, is a Wisdom Council. It is a council of Indigenous elders and healers across the province who actually comes together and, as I say, gives us guidance on this. We work very, very locally with all of our Indigenous communities. Obviously, we are very respectful of not being aggressively trying to push our way in, and we often rely on being asked or being invited to attend to attend their meetings and to attend their gathering so that we can actually work with them in that way. So it is very, very locally driven. After saying that, we do have this provincial resource that actually helps us guide this. And one of the most recent things that we've actually are developing is something called an Indigenous Navigator Helpline for all Indigenous Albertans, who can actually phone this line 24/7 to not only help them navigate the system, but also provide them with Indigenous culturally safe advice and information. So these are some of the things that we're working hard on to try to bridge and help improve Indigenous health outcomes.